All right, we begin with healthcare in Nigeria, and this is linked with foreign exchange. That's what's going to be discussed at the Monetary Policy Committee meeting later on today. Healthcare costs are being impacted by foreign exchange devaluation. I think it was Nairametrics or The Guardian, also This Day newspaper, running stories about blood sugar and blood pressure monitor prices spiking. I think Nairametrics said it was about 100%. Also, you're seeing manufacturing costs soaring, and this particularly is affecting pharmaceutical companies who are not able to keep up with demand. They're facing, erratic power supply, foreign exchange, and so many other challenges that are making manufacturing input costs soar as well. Then you've got purchasing power of the average Nigerian being reduced, and they're, of course, already paying for most of their healthcare out of pocket. So that out of pocket gap is widened as a result of purchasing power being beaten down by inflation, which is, of course, mostly driven by FX challenges. Then you've got Nigerians seeking alternative healthcare, mostly because, well, they're not able to monitor their blood sugar, they're not able to monitor their blood pressure, they got to seek herbalists and stuff like that. So, where's the risk there as well? Let's take a look at a quote from the Minister of Health, the Honorable Mohammed Pate, Coordinating Minister of Health and Social Welfare. He was at a recent gathering where he said the following: less than 10% of Nigerians are covered under health insurance, many funded out of pocket, as I just mentioned a moment ago, beaten down purchasing power. So many of us will be thrown into poverty if met with catastrophic health challenges because we don't have viable insurance. We've got a health expert with us in the studio. Very happy to be discussing with Meenakshi Chauhan, who is the health and wellness expert at the Art of Living Foundation. Very happy to have you. Good morning.
Good morning.
Thanks for joining us.
Thank you so much.
So as far as, the challenges that we're seeing with respect to healthcare and how the FX is just putting this impact on Nigerians, how are you assessing everything that's going on?
Yeah, I think the changes initially brought by the government, I think it was like with a very good intention.
Yeah.
The intentions were to make the economy better.
Yeah.
But I think somewhere we were not prepared enough to meet the consequences. So the consequences, perhaps they were not calculated. So they were like a surprise. So the preparation was not there. But so for what has happened, perhaps we have to accept it for now.
And now, of course, you're talking about the FX devaluation, the subsidy removal, and so on and so forth.
Both the decisions, yes.
Okay, so what are your thoughts on Nigerians having to seek alternative forms of healthcare, like herbalists?
Yeah.
Herbalists scare me, but I understand that they work well. So, you've got experience here. You're from India. You know what's going on. It's the same thing. What do you make of alternative forms of healthcare?
Yes. Because with the economy collapse or crisis, I will call it, with this, we think that alternate medicines is a very good solution for Nigeria for now.
Okay.
Since medical care and everything is hiking. So these alternate medicines where we also offer the Ayurvedic medicine, that is an ancient way of Indian medicine.
Yeah.
There are a lot of solutions. I think Nigeria also have their ancient system like that, that can be revived in a way like with a study or research.
Okay.
I think.
Great.
Yeah.
Now, tell us about the way India works, because as I understand it, the alternative forms of medicine there in India are regulated, and they have to tell us about that. They have to go through almost like medical school. Explain how it works there in India.
Yeah, in India, I have been observing for past few years a lot of revival of ancient medicine, Ayurveda, and other ways of fitness have become very, very popular. Yoga, meditation, breathing exercises. All these have also been very, very popular these days. And they are also seen as the alternate, because modern medicine also has a lot of side effects. And at the same time, attending to the food, what we eat,
Okay, but this is really you're a vegetarian.
Yes.
Amazing. Now, okay, so you've said, and we talked about this before coming on here, that you over at the Art of Living Institute, you folks feel that because costs are so high for the average Nigerian to afford things. Until the economy gets better, you got to do something.
Yes.
So you feel that preventative measures will work. So yoga, diets, exercise, that's what folks have to follow.
Yeah, that's what, there are two types of, medication. One is curative and one is preventive.
Yeah.
So when we see that our systems are not so updated, in India, the kind of medication system has been developed. They are like together with the modern medicine plus technology.
Right.
Yeah. So so technology cannot be built in overnights or in a day. Yeah. So we can promote or make people aware of these alternate medicines and Ayurveda, breathing exercises, which are very, very effective in keeping one's health.
Right.
These are preventive things.
Right.
Yeah. So once, like, to keep the fit for longer.
Okay,
instead of caring later.
What if, like, whenever I hear yoga and I hear breathing exercises and I hear, weightlifting, and people say that these are for wealthy people, these are for the elites. They say that, people at the lower levels of the income scale can't afford to do these things. What's your reaction to that?
I'll say that modern medicine also is for
elites,
them only.
Right? Because it's expensive, right?
Yes,
okay.
Very expensive. Nothing can be done without equipment.
Right.
But at the same time, I'll say that yoga, breathing exercises are much cheaper.
Right.
Because breath is for free.
It sounds so simple and straightforward.
Yeah. If we just put our little bit attention to bringing awareness in our society, and for that we can definitely train our young people so that they help the society to be healthier.
Right.
So, we are ready to offer our hand. We can train people in that.
Right.
Because we have been doing this for many years in India now. We are present in 185 countries. We have centers. We have been training trainers.
On how to live a healthier lifestyle.
Yes.
India is, there's an election going on right now.
Yes.
We've talked about India with technology. We've talked about India with manufacturing. We've talked about India healthcare. India is a major hub for healthcare. Everyone travels. So how did India develop itself to where it is now? What did they do? What's so special about what India did?
Well, I think India has India developed, I think, technology to along with the professionals.
Right.
They are creating a lot of professionals. At the same time, they are they are involving a lot of technology as well.
Every time you say technology, you make my heart sing, all right? Because we strongly, so technology is one of
I think so.
The main things that have put that together.
Because engineering and medicine both goes together in India, I think.
Engineering and medicine. It sounds. So what lessons, if you are here in Nigeria or you are in a Sierra Leone or Somalia, anywhere else, and you're looking at the India model, what's the lesson to be drawn from it? It is basically, before I even get to that, the manufacturing of healthcare, drugs, and so on. We face that as a challenge here in Nigeria. But India doesn't have that challenge. Is it basically because India manufactures its own healthcare items and goods and so on in the country? Yeah,
there are a lot of pharmacies and herbs also grown. But what I feel is very strongly for these days, people in India have really giving more importance to the alternate medicines.
Right, which is the simple breathing exercises, yoga, healthcare, and all that, and simple.
There is homeopathy, there is Ayurveda, there are acupuncture, Asian medicines.
Right.
Everything is becoming very popular these days. Yeah. Yoga and everything, meditations. It's because. And a lot of food awareness is also coming there.
We haven't touched on food. So sorry, I asked you about you being a vegan and we jumped to something else because I got too excited. Talk about the diet. Let's talk about the diet. How important the diet is. So
diet is also very important because a lot of things I feel comes from the diet.
Right.
Yeah, because in Ayurveda, this is said that the basis of our system or basis of our diet is the digestive fire.
Yes.
That is called Jataragni.
Right.
So if our digestive fire is healthy, we are taking the healthy meals, so we are experiencing a healthy body. If the digestive fires are disturbed, we experience some sort of imbalance.
Disruption, yeah, exactly.
Imbalance. Yeah. And for that, what I feel is that this awareness is very, very important. What should we consume?
Right.
So what I feel is by nature also we are very, very close to the vegetarian diet. Yeah. Because our teeth, our jaw, our intestine, it's very close to
eat plant-based food. It's hard to sell vegetarianism to Nigerians. Me personally, I love meat. I love chicken, fish, beef, all that stuff. But so, is it possible? Can I be a vegan? Can I switch to?
For that, I will not advocate vegan or vegetarian. But what I will say is taking a middle path or beginning with a discipline. We mock in India. We say, oh, if you are a non-vegetarian, why you are keeping a discipline, not eating on Tuesdays, not eating on Thursdays, or not eating for some 9 days or something like that. But here, when I come here, I understand that it is a very good to begin with, to start with. Keeping a discipline that, okay, this is the day I'm not going to eat any non-vegetarian food. Okay, for 5 days, for 9 days, for a week, for a month. So like that, we can begin a discipline. We discipline ourselves. And I'm not saying that we should be, but, where our health is getting compromised, where we think that, oh, this is becoming too much, it is damaging our health, there we should be able to keep a filter. I think that should be there.
I thank you for coming on. It's a very straightforward conversation. I mean, until the economy gets better and people are able to make more money and afford these medicines and healthcare, I mean, the government has to do its part, but individuals have to do their own part as well. That's fantastic. So, Meenakshi Chauhan, health and wellness expert at the Art of Living Foundation. Thank you so much for your time.
Thank you so much. My pleasure coming here.